As the cases of coronavirus reach above 1,300 in South Dakota, healthcare workers there on the front lines are gearing up to fight and be in the fight of their lives. Reporter Angela Konecki this afternoon checking out Avera hospitalists who are working exclusively with COVID-19 patients.
Avera hospitalist Dr. Nathan Miller arrived at our interview wearing goggles and a mask. But when he's in a COVID patient's room, he puts on the hooded PAPR mask.
The hospitalists are wearing those on the COVID-19 units in every room, essentially so we can conserve the face mask for the rest of the healthcare team.
Dr. Miller says everyone at the hospital, from nurses to physicians to housekeeping, is picking up extra shifts right now.
What we've seen is a slow, steady increase in the number of patients with COVID-19.
36 patients are currently hospitalized with the illness in South Dakota. Dr. Miller says he's confident the health systems will be able to handle an influx of patients, even with Smithfield Foods, now the #1 hotspot in the nation, with 733 related cases and counting.
And you are really in the hotspot. You, as a physician, are really in the hotspot right now. Do you feel that? Do you feel that pressure?
You can feel it ramping up a little bit, yes. I do feel we have a good plan in place, and I feel we have a good surge plan in place for if we need to have additional personnel.
Dr. Miller says everyone working in the hospital is concerned about bringing the virus home. Dr. Miller is married with 3 sons, ranging in age from 5 to 10. He explains the precautions he's taking to try to keep his family safe.
For me, it's bringing a separate change of clothes that I wear in, and I change into a different set of clothes and bag those up when I leave and go home, and then change into ones that I came in with. Shower before I see anyone as well.
Do you stress about that? Does it? Yeah.
I try not to, because as my wife said, we should take it one day at a time, because if you look too far in the future, it could be overwhelming.
Are you nervous about what's to come in the next few weeks?
Oh, I have a little bit of nervousness, but again, if I didn't, I think it would be dangerous if I didn't. Like I said, I don't have severe anxiety, but I respect the disease. I respect what we have before us, and I think it will be a challenge. I am confident that we are planning. I am confident that with anything we will always have to adapt, and I'm confident we'll get through this.
An interesting viewpoint, and again, that's reporter Angela Konecki. Dr. Miller also says that he cannot stress enough the importance of everyone doing their own part, following social distancing guidelines, and staying home if at all possible.